Hi, my name is Jody Swimmer. I'm a student physical therapist at Bellarmine University, and this is 40-something, my 9-year-old American saddlebred gelding, and we are learning the art of dressage together. In order to try to tell you what dressage is, think about a horse out in the field, loose, playing, running, galloping, trotting, twirling, fighting, all those things they do on their own. That is what we try to capture under tack, with the saddle, with the bridle, with the rider in dressage. It's a series of gymnastic exercises to help develop the horse gymnastically for agility, lightness, cadence, rhythm, flexibility, all with the rider. It's a blast, it's hard, it's probably the hardest, well, besides physical therapy school, it's probably one of the hardest things I've ever tried to do, but it gives me joy trying.
The movement is called a half pass in dressage, and the purpose of the half pass is to have the horse move forward and laterally while maintaining straightness through his body. The horse should be bent around the inside leg, looking in the direction he is going, while crossing his outside front and hind legs over the inside legs, maintaining his rhythm and cadence. The inside hind leg on the horse must remain forward and balanced. This movement is performed at the trot and canter, and it demonstrates great athleticism in the horse, acceptance of the bridle, and the rider's body. You'll see us in a starting position where the horse is in complete straightness on a vertical line. He should show 2 steps of straightness before moving diagonally across the line to the other point in the arena. Both the rider and horse should be looking at the ending point across the arena. Basically, you put the letter in between the horse's ears, and you move that horse with straight body diagonally to the letter. The rider's inside leg should be in a straight line from the hip and knee, where the outside leg will move back from neutral to cue the horse to move his hips with the rest of his body. And the rider needs to drop the weight down into the inside ischium to have more weight placed on it to cue the horse to move into that direction, which we call the inside seat bone, while maintaining the correct bend of his neck and poll. It's probably more difficult to ride the sitting trot correctly than the canter movements, and at the sitting trot we are looking at the pelvis on femur activity in a closed kinetic chain with the feet in the stirrups. The pelvis must move in rhythm with the horse's back. The abdominals, as well as hip strength and flexibility, are vital components to mastering these advanced movements. It is important to not let the hip and back muscles move into extreme flexion, lordosis, or anterior tilt. The pelvis moves into slight extension, posterior tilt, and back to neutral with each trot step in order to stay in rhythm and not put pressure on either the horse's lower back or the rider's. The concentric contractions of the abdominals and hamstrings, moving the pelvis from posterior tilt to neutral, is a great example of synergistic muscle activity. The hip movement is a concentric contraction while moving posteriorly and eccentric as it moves anteriorly. It is important to keep the horse's energy under your ischium at all times and at all gaits to keep the horse moving forward. The gluteus minimus and medius work to maintain the adductors in medial rotation throughout the ride. The gluteus maximus is used primarily for stability. The hamstrings are working concentrically with the posterior tilt and eccentrically with the anterior tilt. The abdominals are concentrically contracting in rhythm with the posterior tilt and back to neutral, a movement in dressage that we call the half halt. And in the half halt, it's a brief slowing down of the forward movement of the front end of the horse, so that the hind end can catch up and engage. The half halt slows or suspends the horse's movement through your pelvis, up through your abdominals to your hand movements in the horse's bridle. And we want the horse to rebalance constantly during training because he tends to lose engagement. And the half halt is a subtle means to correct and rebalance a horse so that he will learn what is expected of him and not be confused with transitions. The gluteus maximus, or the seat, holds the movement for a fraction of a second by transferring the weight down. This is all done through quick concentric contraction of the abdominals, hamstrings, and glutes, as well as movements in the hands. The adductors are mostly isometric throughout the ride, and movements, but concentric contractions will occur as the rider brings her outside leg back to cue the horse to move his hips laterally. The abductors are working concentrically at this time. And to hold the foot and ankle in neutral, the gastrocnemius muscles are working concentrically to counteract the external forces that tend to cause valgus at the knee and pronation of the feet. The foot and ankle muscles work across a medial lateral axis in dorsiflexion and plantar flexion, and the anterior posterior axis with inversion and eversion. The pelvis should stay in the frontal or coronal plane. The knee should remain medially rotated in the transverse plane, primarily in isometric contraction throughout the ride. The knee should not be tense, nor should the knee flex greater than 90 degrees. The lateral malleolus of the fibula should fall directly under the knee with the foot in slight dorsiflexion, about 10 to 20 degrees, and moving to plantar flexion, about 25 to 40 degrees, when the leg is brought back to push the horse's hips, keeping the horse underneath the rider's ischium. This is particularly apparent as the horse is moving across the diagonal pattern. Sometimes it's necessary to give the horse an extra push with the leg in order to keep his body moving straight underneath the view, while at the same time you're cueing him to slow down in the front. And you will see me pull particularly my right leg back, and it does approach 90 degrees. It's interesting to watch yourself in a video, and you'll also see me plantar flex. You will also, unfortunately, see me lean to the right at the same time. These are not correct movements. The rider should remain upright at all times. And when I'm bringing my right leg back, flexing the knee greater than, well, it's not going to 90, but when I'm flexing it into a greater degree and leaning to the right, I'm putting my iliopsoas in an eccentric contraction, and that's how you hurt yourself. So, in the rest of the paper, I do discuss exercises to try to prevent these problems, but I really just wanted to show the half-pass in dressage and demonstrate that it does take a lot of athleticism in the rider. It's a really high-level performance for the horse, and it takes quite a few years to get a horse to perform the movement well. And my horse does it better than me. I'm trying to keep up with him, and I kid with my trainer that he's going to have his degree sooner than me, but that's okay. This is all for fun.